Hello everyone, I'm Dr. John Oldham, Chief of Staff of the Menninger Clinic, and welcome to our new series, Menninger Mindscape. It's wonderful to have a chance today to talk with Dr. Walt Menninger, who is a pioneer and really leader in the field of psychiatry, and certainly well known as one of what I sometimes refer to as the Menninger dynasty that led to the creation of this wonderful institution, the Menninger Clinic. I had the pleasure last year as president of the American Psychiatric Association to give Walt a Distinguished Service Award at the meeting of the APA, and indeed he deserved that and has done wonderful work for the whole field. So welcome, Walt. It's delightful to have you here.
Thank you, even though you've overhyped me.
No, I don't think so. But we're great, it's really great that you can join us. And what we thought we would do, just for the audience to understand, is that we're going to actually do a series of 3 of these segments. And so today we're going to talk a little bit about the early days of the Menninger Clinic. Next time we'll have a second segment talking about really as Menninger grew, some of the wonderful expanses and advances and activities that became nationally known. And then we'll have a third interview really to talk about more recent times when there have been some big changes. So we'll have front door to the present day tour about the Menninger Clinic. So today we're going to talk about how things got started. And it's sort of remarkable, Walt, that an institution that became such a landmark got sort of born in, I say, the cornfields of Kansas. But tell us a little bit about how the Menninger Clinic got started.
Well, it is really a function of the drive and interest of my grandfather, C.F. Menninger. He initially left his home area of southern Indiana after college to become a faculty member, a teacher in a small college in a rural town in Kansas called Oldham. And he taught science and other courses. And subsequently, after he got married, he decided to become a doctor. He went back in the late 1880s and got actually a homeopathic medical education. And when he went into practice in Topeka, Kansas, in 1890, he was keenly aware of how much he didn't know. And he constantly sought ways to educate himself and learn more, although at that time, medical practice, there were limits to what they had that they could really do to help the patients. He was a general physician. He wanted to be able to share with other colleagues. And everybody had their own technique, and they were very close-mouthed. And while he developed his practice, partly because of his character and the way he could relate to patients and infuse hope and kept in touch with what he could know by reading journals and going to visit medical centers. The moving moment was in 1908, by which time he'd been practicing for 18 years in Topeka, had a solid practice in the community.
It was general medical practice.
General medical practice. So he delivered babies, was always frightened about the complications potentially of a placenta previa in OB or whatever. But he went to Rochester, Minnesota for a medical meeting and was impressed with the pattern of practice that was there carried out by the Doctors Mayo. The original Dr. Mayo was a generation ahead, was older. And there were 2 younger sons that were in practice, and they had gathered a group, and they shared information, and they shared their experiences and learned from one another. And it sounds apocryphal, but he came back to Kansas, and at the breakfast table after prayer, he looked at his 3 sons and said, "Boys, I know what we're going to do. I've seen a great thing. And we're going to have you become doctors, and we'll practice together and create a clinic like the Mayos." Now, the eldest son, after thinking about ministry and turned to medicine, and then at Harvard Medical School became very much interested in psychiatry under the influence of the professor at the time, Elmer Ernest Southard.
So I'm going to interrupt you for a minute.
Yes.
So that original proposal was really to found a clinic, but not necessarily a psychiatric center.
That's correct.
Okay,
No,
that's interesting.
No, grandfather was just wanted an opportunity for colleagues to share and enhance their practice together. And I'm sure he was thinking of the model of surgery and medicine as the Mayos. But he had an interest in the psychological side. Actually, in the early 1890s, he ended up presenting a paper on the insanity of Hamlet to what was known as the Saturday Night Literary Club. And he read and kept up on psychological matters. And so when his son, the eldest son, who was Carl, got interested in psychiatry and then came back, grandfather was fine. The initial Menninger Clinic had Dr. C.F. in general practice, and by that time he was quite a specialist in dealing with diabetes. This was before insulin. And Carl was in psychology, in neurology and psychiatry.
And the two of them really
The two of
started
them
it.
were practicing together. And this was the nidus of the Menninger Clinic. The youngest brother, the middle brother, had an accident in his college years and ultimately went into a different profession, journalism. But the youngest, William, he was going to be a medical missionary and had training in medicine and surgery at Bellevue. He actually went to Cornell Medical College. But in 1919, apparently the opportunities were not there, and Carl said, "Come back, we need you," in 1925. And by that time, they had bought a farmhouse to serve as a sanitarium, a hospital for patients who couldn't function outside the protected setting. And my father was Will. When he came back, Carl put him in charge of the hospital and went off to some place to study. And so Dad became a psychiatrist without any real psychiatric training at the time. But that became the nidus for Menninger. And grandfather was really quite comfortable with the advent of insulin. His whole approach to treating diabetic patients was revolutionized. He didn't need to have the same intense care of diet and everything else. And so he would do the general medical care of the patients that came for the psychiatric hospital. And he was, again, remained committed to education and research. And they practiced it. Carl went off and got learning, and this was the evolution.
Well, that's so interesting. I had not really been as clear as you've just made it, that CF was really doing general medical practice at first and then sort of continued as kind of the internist once the Menninger Clinic was established as a mental health treatment center.
And he evolved, and even in his late 80s, he worked with, this would have been in the 1940s, that the mid-40s, so he worked with patients, but his was a lot in terms of activities of gardening or mineralogy, or he taught shells, conchology. I mean, because the patients loved him, he had this way of relating to them in a kindly manner. And so he remained involved.
Well, that kind of attitude and that kind of connectedness with other human beings and with patients is so centrally key to success in working with anybody with a psychiatric or a mental disorder. So that really clearly was a message that helped the whole enterprise grow. We have it on the wall here, photos of that first little farmhouse, which was where the clinic first got born. And
It kind of grew like Topsy.
it's pretty amazing to think what's happened after that. Now, I'm going to interrupt at this point because I'll clarify that we're trying to do the impossible here, which is talk a little bit about the whole history of the Menninger Clinic in a series of 3 very brief segments. Well, we can't even begin to do that. So we're going to hit a few high spots. This is great. This is really, really tuning us in to some of those very early moments that led to what I don't think any of them themselves probably could have predicted at the time, to a landmark institution. We're going to stop at this point today, but in our next segment, we'll move to when the Menninger Clinic really became known throughout the country and really throughout the world, and you'll tell us a little bit about that. So we'll stop at this point and see you next time.
I'll be here.
Great.